And we're back, and we're getting ready to move into our first conversation for today. As we mentioned, we are trying to stay up to date, getting all the information that we can, providing it to you in preparing and keeping safe as we all watch the pandemic as it spreads globally. We're joined by Dr. Fernando Cuellar, who's an internist at Belize Medical Associates, and we're here to talk about a lot of things, COVID-19. But good morning, and thank you for being here.
Good morning, Marlene. Good morning, Armin, and thanks for the invitation. I feel like I'm home when I come here. It's my third home.
You know, it's a really critical time, I think, for Belizeans this morning. The announcement was made last night about the third COVID-19 case in the country.
Confirmed.
Third confirmed. Very valid point. And while the Director of Health Services did not say what region, the information suggests that it is a person who is on mainland Belize and most likely in Belize City. We know the Prime Minister is to give a press conference or press update to find out exactly what new measures will be taken. But as a physician, and I want to be clear, an internist is someone who does intensive care and, well, but you also are very aware of the type of treatment that it takes to get someone to recover from this illness. Let me start with your perspectives.
Well, as you said, that I do the internal medicine and I do intensive care.
Yeah.
You hear about intensive care and ventilators and so forth. Honestly, I don't want this situation get there. I don't want we use one single bed for intensive care for this thing in Belize, okay? Because by the time they reach intensive care, they got 1 foot in and 1 foot out, okay? And we try pull it out, okay? The bestest medicine for this right now, the preventative, okay? I repeat, the best medicine, more than the fancy machines and so, for the preventative, which is stay home, social distancing. And every goddamn Belizean need to have the responsibility, the duty to themselves, to their family, to Belize country, for practice their thing appropriately. Okay? You don't need government for to tell you, stay home and do this. You have to take it by your own and do that. Okay? And whatever the permutations, the adjustments you need to do in our lifestyle, start to do it now and figure out that for the next month, maybe next 2 months, do it that way. But for yourself, for your loved ones, for your neighbor, for whoever, you need to start to do that. Okay? And not they expect that, oh, government not got so much ventilators and testing and blah, 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 and blue. No. Stay the F home. Okay?
Strong.
I never cost Marlene.
I know.
Okay? I think stay the F home and social distance. These are the best way to get this thing. Okay?
The seriousness with which you're saying this message and clearly opening this way, it's with a particular reason. I've found that conversations with medical professionals especially, they are most concerned that if people don't do what they have to do right now, what the future may hold. And that's the critical part. Dr. Cuellar, you have been talking about preventative medicine for a long time, from people with diabetes, hypertension, everything under the sun. But you know it's hard, that people don't always listen and they always take things lightly, especially if they can't see the immediate threat.
Right. Valid point, Marlene, but this is a different horse. This is a different animal. Worldwide, planet-wise, we have never faced this before. Nobody have all the correct answers. But clearly, we look at countries that have gone through this. It is clear that the countries that do the draconian measures, and draconian mean that the hard measures, condone hard, early, that the one will come out the best out of this. Okay? Which will put me to my next point. One demand that the Prime Minister and the leader of the opposition and the czars shut this country down today or as soon as possible. I demand. Okay?
What is your justification for this?
Because these are the best medicine, Marlene.
Okay.
These are the best medicine. These are the best remedy. And these are not my thing. Me not so bright for come up with their ideas. Okay? But look at the countries. look at the testimonies. Then you try, why, if we do this now, well, economic this and economic that, maybe if you not do it, it will be worse. It will be worse. The cost of not doing it will be worse. And I want to implore that the technocrats at the top, the Manzaneros and the Judge Gaff and the, well, them people were in the Ministry of Health demand that it happens this way. Okay? But I have another point.
Go ahead.
I want to applaud the healthcare workers. I want to apply the nurses, the ICU people, the hospitals are standing by because we wait for the wave come. But the people them where they do the preventative, the mapping, which you know what happen, they happen. Okay, then are the people where have to go and okay, case number 1, case number 2, case what are you made there? They have to spend that lengthy time in contact with them.
Yes.
Okay, hopefully properly protected, and tell them, listen, I'll spend the next 4 hours to tell her, you're going from point A to point B, you remember who you say, who you never see, who you talk to, who you come in contact with, and then that's how they do the mapping or the contact tracing.
I'm so glad that you brought that up because I wanted to be able to clearly talk about what that involves. I mean, it's like if I stop for tacos, all the little details in between. So you have to go back and try to find every person that you came in contact with.
Every possible contact. You could get most of them. I don't think you could get all of them. But definitely, you have to do that vigorously.
Which is interesting here because in the third case, the third confirmed case, we are saying that the individual entered the country on March 20th, took ill on March 25th, so that when he flew into Belize, not only were the frontline workers at the airport exposed, despite the fact that he was asymptomatic at the time, but between March 20th and March 25th, God knows who all this person may not have been in contact with during that period of time.
Well,
and we've talked about self-isolate, which is questionable.
Exactly. Exactly.
We have to define what isolation and quarantine. No? That means that you are staying in your house, hopefully staying in a room, if you have that facility at home, because sometimes we tell people for self-isolation, you got one room house. But keep to yourself as much as possible. In a house, you have to do your same hand wash every 15 minutes, every hour, whatever. Practice all of the good things then, like use lead tissues for wipe your nose, cough, then kind of thing. But you could self within your house. Now, I do think that we forgo for self, meaning beg pan the good sense of the person. We see that that hasn't worked within, that's only past 2 or 3 cases. Mandatory. Okay.
Well, that's what the
Expect
recent
they go home.
release.
If you need be put on police front of their house.
That's what the recent release is saying. That essentially they will be quarantined at their own expense, and we've seen some areas
Mandatory.
be set up
Put
already.
one police side there and say, don't go nowhere else. Well, you're fine. Yeah, you're going to jail. Okay. Draconian measures. But you can save the country millions of dollars. You can save a lot of deaths from happen. Okay.
You spoke of the shutdown or the shelter at home. There are lots of terms that people use all over the world, the lockdown. But explain to me from a medical perspective why this is critical. Right now we're being asked to social distance, minimize gatherings to 10. There's some steps being taken.
Because the virus don't move by itself.
Yes.
People have to move it.
Yes.
People have to move it. Even if they're airborne, people still move it. So if you stay in a room where nobody there, only the TV don't catch virus. Okay? Your clothes don't catch virus. Well, they catch, but they can stay there. But you're not spread from person A to person B. So stay locked down. Okay? This time a bullet where you can't see the come. Okay? And you have to know, you have to dodge it before it come in your direction.
My observation, Doc, is that while this is a very deadly strain of virus, when you look at some persons who have come forward in other jurisdictions to say that they have tested positive for COVID-19, some people get through it fairly easily, whereas others, the death toll keeps mounting.
I mean, this is a new virus.
Isani, just to correct you.
What am I again?
Love FM.
Love FM, sorry.
Yes.
Go ahead. this is a new thing. We don't know much about it with the land as with the go along. Okay. You said deadly, but in truth, you have more deadlier disease.
Okay.
Okay, so you're not that deadly. You're very spreadable though.
Okay. Communicable, right?
No, coffee, I don't know what that what that's spreadable.
Contagious.
Contagious.
Yes,
Yeah.
So out of everybody who get sick, he could infect, mess up 3 other people easily.
Yeah.
Okay. And then you heard at the beginning you may hear, "Boy, this is old people disease, and over 60 you have to have diabetes." But clearly, the data, the information will come out that younger people they get licked up.
That's right.
Big time. Okay. New York, they see it right now.
Yes.
Big time. So everybody, even the young people where they hang out, no, you at risk for death, and what's our, you want contaminate other people where in a worse condition like you.
Yeah.
So, okay, so looking at the numbers, and I always say this, there's a lot that we don't know, and the information is collected as we go along. We're 3 months into the discovery
The world.
of this new disease. What we do know is that 80% will have mild to moderate symptoms, but 20% will most likely require hospitalization. I'm sure you've seen the stories of people in hospitals. This is not, as was first communicated, a bad flu. In fact, it's a lot worse than that and requiring very intense treatment within the hospitals. Talk to me about that perspective.
Very good point, Marilyn, because then statistics are true. And this if this serve anything, this one calm we don't. Everybody are panic today. Believe you me, panic they happened from last night. So we need to tell the Belizeans, be overcautious, but no need for panic. Take care of yourself, no need for panic. Okay? You no need for to run wrong like chicken without head. Okay? So out of 10 people will get it, 8 of them could stay home and stay in their room if they have a room. Okay? The next 20 will need hospitalization. That part, out of that 20, that 15 will need hospitalization. It is our duty as the healthcare workers to not make them get worse so that they need intensive care. So they need the oxygen, they need monitoring good, we need the x-rays, we need the blood gases, we need all that. So we prevent that go the next step. The last thing I want to say, that the ICU full up. Because when ICU full up, mean that take up one bed for 14 days, 10 days. And what happened to the other things where when really did non-COVID? So it put one strain on the whole system. Okay, so one of our biggest focus, I think, and I'm glad that the Kalushna and other districts, hospitals, everybody, they put things in place so that they could take care of people requiring hospitalization.
So we seem to be taking a phased approach here in Belize, looking at things changing with the first case. Right now we're at imported and close contact. The next phase would be human-to-human transmission, which means someone got it or someone tests positive who didn't travel or who didn't knowingly come in contact with someone with COVID. But you said that you feel the best time to be able to shut down is right now, before we even detect the human-to-human transmission case. That's what you agree with?
Yes, definitely. I well trained and I like them fancy words, but imported.
Imported means somebody bring it in.
I know what it means.
Yeah.
But the virus don't grow up on tree. It never grow up on no Belizean tree. It had to come from somewhere. Had to come from somewhere. If we never find out where it come from, then, oh yes, this is not imported. This is community spread. Then call it community spread when they do all an improper tracing and say, you know what? As far as we don't know, then you call it community. You don't get there yet. Well, I don't know about this last one. But we're not for the confused people, put imported and local and community spread. We got
But it makes a difference in terms of understanding how far the virus is spreading. I mean, in the United States, for example, when people suddenly popped up who did not travel, you realize that basically the disease is moving around without us knowing.
Exactly.
Yeah.
And this, I mean, the point now to highlight is that you could have no symptoms and you spread the disease or shed the virus, then call it. Okay, but you could spread and you feel good. But boom, 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 you let out that virus big time. Okay, that's why we have to have that social responsibility and we have to protect ourselves. Okay.
All right, so let's talk about what responsibility we should have. So people should stay in as much as possible and minimize contact.
And come out only when absolute necessary.
All right.
Either for your essential job, or go buy grocery,
Yeah.
or go fill up your medicine, or go buy water. You cannot got nobody for bring water for you, or something like that.
Yeah.
Unless it's absolutely necessary, you come out.
Yeah.
And each workplace should already, because they're not today we talk about this thing.
Yeah.
These are 3 months now. Each workplace should have at least on paper one plan,
Yeah.
and I know for execute that plan. I call on other people, the religious leaders, the council of churches, the chamber of commerce for work with the businesses. I call on the NGOs, the industries. Everybody have to chip in
Yeah.
for make this thing go, and we could get through.
Let me ask you a
We are
question
tough
here,
people,
Doc,
man.
quickly. So there's no known cure for this virus. How can it be treated? In terms
Basically,
of-
we call it supportive treatment. Okay, meaning that we not got one medicine where we knock out the virus. You hear a lot of experiments happening, a lot of trials. We hear about Plaquenil and Zytromax and the antivirals. Okay. And with the grab at anything, oh shucks, this one look like it
It's
works.
kind of trial and error, isn't it?
Exactly. So we don't got one specific treatment. When they reach, when they need hospital, you need oxygen, your IV, make sure that you deal with other, because not only virus exists, you got a blood pressure to deal with, you got a sugar for deal with, you got
Yeah.
a kidney function for deal with, and God forbid they need intensive care, you need a ventilator for help them breathe, because then they struggle, they can't breathe. And if you don't deal with it in a couple of hours, you call Mr. Alam or Mr. Kowe. Okay, that's it. You think? And by the time I reach ICU, maybe we're in a trouble.
It's already
We're
critical.
in a
like-
trouble.
Yeah.
Yeah.
Okay, no care how fancy ventilators we use, and we could go a room full of ventilator.
Yeah.
Okay.
It's interesting that you
Okay.
said that, because I know a lot of people are very concerned with
Exactly.
number of ventilators.
I have asked advice for got ventilator home. They want to get money.
Yeah.
Could I buy a ventilator because they know the system will get or could get
Overwhelmed.
overburdened.
But your message is do what you can not to get
Exactly.
there. Let's talk about our high risk populations though. So we have on average, I believe the last count was about 7% elderly population. We have hypertension, diabetes, very common in the country. We have people who are on cancer treatments. We know people who are asthmatic or have lung or heart disease. They will also be at risk. What's your advice to them right now?
Yeah, they have a certain sector of the population where know that the immune system compromised, and then do on daily practice in our everyday life.
Yes.
People with cancer therapy, people with HIV, people with diabetes, people with autoimmune disease like lupus. So they don't make that one level of care or concern about getting sick now. So they need for ratchet up one a little bit more, okay?
Yeah.
Double it up.
Yeah.
Now, the people anyway, like got lung diseases, they also, you have to consider, the asthmatics, the people with emphysema, with chronic bronchitis, with COPD, then kind of thing. They also need to be on the lookout more. Sugar and pressure also in this category.
Yes.
Okay, and there are specific medical reasons why they single out the two conditions.
Yes.
Okay, when it comes to sugar and pressure for this particular thing. So people with high blood pressure, people with heart disease, people with that. So that put you at 15 different specific groups of medical condition where you have to be on the lookout for. And if they catch it, then they one way do worse.
Yeah.
Then they one way do worse.
Should they
Okay.
perhaps make attempts to be even more isolated than the rest of the public?
Absolutely, absolutely. And I am relieved that there are people who reach out to your doc, I don't want to come out, I don't want to
Yeah.
go, give me 3 months medication.
Yeah.
And if I need anything, I could call you, or I could call the hospital, or I could call somebody.
Yeah.
So they don't have to expose themselves.
That's a critical
Yeah.
point. I know the Ministry of Health and NHI have put out a notice that if you are on medication for diabetes or hypertension, or if you have medication to collect from them, you can get, I think, 2 months worth
Right.
of medication. All you have to do is call. And that's the other thing. If I have hypertension or diabetes, should I perhaps avoid going to a public clinic at this time?
Of course, you dip on medication, you make sure you get a supply. Unless you start to feel unwell,
Yeah.
then you try the phone lines first.
Call first.
Try first, and maybe you
Yeah.
could get help that way before getting, unless it's really necessary, then you go to your clinic.
Here's a
What we
curiosity of
haven't-
mine, and I'm not sure who to ask the question, but I'll just put it out there. How long are we to wait this thing out? Because some people are saying 2, 3 months.
A lot of people ask that.
What if it rears its ugly head in September, for instance? We're far away from 3 months in September.
Yeah, those are valid, very valid concerns, and even the leaders have trouble because they have to plan, no? They have to plan for the country. Boy, I'd say make we prepare anywhere between 1 to 3 months from now. Or on the side of overcaution.
Yeah.
So it subsides in 3 months?
No, that's the thing.
We
don't know yet. We don't know if when we get exposed to it, if our body makes, our immune system makes the level of immunity so that we don't catch it again. We don't know yet. So those are very much on an answer. We would think, like every other virus, you do create immunity, right? Hopefully this one will behave like the millions of viruses that exist, and you do develop immunity afterwards.
Which is why
but
a lot of
all our immune system have not been exposed to this part, so nobody got immunity right now. And then they do studies right now from the China and the South Korea, where they have gone through the worst, and then they figure out, well, we could measure how to measure the immune system, the antibodies, so that we could say, you know what, this person is thing. And that come in hand with our vaccine, now that we hope by the end of the year we could get to a valid vaccine.
I mean, I think that's why everybody's watching China right now, to see, they're 3 months after, to see what's happening there. And we know they're having challenges with cases being reintroduced as well. But I want to go back to the clinic visits. We have not seen here as yet, where we've seen in other countries, where a specific respiratory clinic is set up. In other words, if you have flu-like symptoms, you go to one place so that if it's Cleopatra White, for example, I don't have to go to Matron Roberts and expose the pregnant women who come in for care or the other people who are coming in for care. Is that a move in the right direction?
Definitely. And that means parallel to Catchville Medical, where we shoot ourselves in the foot. I think that release will be a bit too premature because the system weren't fully in place yet. It wasn't tested. Okay, so hopefully this week we can have that in place. Not only in Belize City. Come on. Arinjoa, Carazal, Stanford, everywhere. Okay, even our village, even the Barranco. It make we have one spot where we take care of respiratory symptoms. Okay, so hopefully, and I know that lots of efforts are being put to do that right now. We don't want everything done, but it can't happen so fast. Okay.
Now, looking at the situation that we're in right now, you move around. We can only talk about Belize because that's where we're based. But there are some who take it seriously, and I can see less movement. But we still see some people moving around and kind of casually living their life. What would be your message in terms of having them understand the gravity of what we're facing?
Looking at car and stay there at home. And if you don't stay there at home, they'll pick you up and put you home. Okay, with a plea to your reasonable and your brains, and we know, and you care, and with a loving country and so forth. But if you not do well, we tell you for do, maybe better ask you for do, we will pick you up. Thing done. Okay, enough talk. Enough talk. This is a time for act now. And we Belizeans have the responsibility for doing the correct thing. We have the best medicine that we had. We don't need Dr. Cuellar and Dr. Arriaga and Dr. Hidalgo and the fancy boys. We need ourselves for common sense and your family.
You're right. You're literally right in saying that it's all in your hands. Because that's where it begins and ends.
So you bring your alcohol with you? Is that what you have there? Or hand sanitizer?
Hand sanitizer, my dear. I had a big time.
Okay.
All right.
Then jack you for your hand sanitizer, no for your chin or your...
You know, it's a very concerning time. And I think if we keep on watching the U.S. media, which is predominantly what we're exposed to, we can see how bad it can get when you're talking about their healthcare system being overwhelmed. But the difference is that they have a lot of mixed messages going out, and they also have had a delayed reaction in terms of shutting down or limiting movement in their different states. So your recommendation, we're hearing from you very clearly, is do the shutdown from now.
the man. That ain't my opinion. The man was shut down.
Yeah.
Okay?
All right. Any other advice you'd offer to the public?
Don't panic. Don't panic. In my practice, I've seen stressful situation, and as a leader of the team, you should not panic. You transmit that to your team, and things go better.
Yeah.
The moment you start to panic, everybody around you panic. But you have to stay
Then
calm.
mistakes are made,
and
etc.
exactly, calm and collected,
Yeah.
and you get through this.
What do you say to your colleagues in the medical profession who are
Speak up.
perhaps more concerned?
Speak up.
About-
We so loving, and we tend to shut up and no one match nobody too, and blah, blah, blah. And you know, this is not just about COVID, this is about everything. So speak up, right? Get on the famous social media, buy yourself time, and Medical and Dental Association, Nursing Council, any relevant bodies have to speak up. Demand, okay? Wanna know where they talk about, okay? The Nursing Association come out or the Nursing Council come out today and say, we demand a shutdown, okay? They're not just crazy queer they talk.
Yeah, it's a very critical situation, and I think that we appreciate your honesty and your stern warning as well. We all have a responsibility to play, and we have to do our part. Thank you.
Thank you, guys.
All right, we're going to go ahead and take a break. When we come back, we're going to be talking about self-isolation, speaking to one person who has been in isolation since he returned from outside of the country. That's coming up after the break.